Welcome to Health Options, the first edition in 2019. I am Rabi Abdullah. Thanks for joining us on the program. A new year provides opportunity for stock taking and time to look forward to new prospects. That's why this edition of Health Option brings you the high and low points, successes and failures of the Nigerian health sector in 2018 as we review the year. The Nigerian health sector, no doubt, had a lot of positives going for it in 2018. The inclusion of the 1% Consolidated Revenue Fund into the 2018 budget for basic healthcare provision and its rolling over into the 2019 budget raises a lot of hope of better days ahead for the Nigerian health sector. A peep into the Nigerian health sector gives a picture of a mixed grill of the good, the bad, and the ugly. A major high point of the year under review is the inclusion of the Basic Health Provision Fund in the 2018 budget, set to be to the advantage of the over 90% of Nigerians not captured by the National Health Insurance Scheme.
The fact that, for the first time in the history of the country, Nigeria has made a huge political will towards universal health coverage. And how did this happen? Because in 2018, for the first time, the 1% Consolidated Revenue Fund of the federal government to fund the Basic Healthcare Provision Fund was budgeted by the National Assembly and also signed by the presidency. However, just to say that that money, about 55 billion naira, has not been released. It's a good step in the right direction because this is the first time it has happened. So that's a good thing. That's probably not different from, the bureaucracy in government in releasing funds. This money has been budgeted for. Why not release it? Because it's supposed to cover for, healthcare for some of the poorest people in our communities. However, 55 billion was budgeted for in 2018. It's not been released. 51 billion has been budgeted for in 2019. So that means that in 2019, we'll have about 106 billion as part of the CRF, the Basic Healthcare Provision Fund. So this is the time for people and for CSOs, everybody to begin to push government now at the federal level. The National Agency for the Control of AIDS, NACA, was funded by the U.S. government, the federal government, and other partners to conduct the NICE survey, that is the National AIDS Impact Indicator Survey. Because what that is going to help us do is that it's going to help us know the actual prevalence of HIV/AIDS in the country. For now, they say about 3.4 million Nigerians live with HIV/AIDS. However, according to the NACA DG, when you go to some sites where traditionally they say that prevalence is high, you don't get people living with HIV/AIDS when you take samples from those locations. So the NICE survey is such a huge thing because once we know the actual people living with HIV/AIDS, then we can properly intervene, give them drugs, and ensure that they live longer lives just like any other person in the country.
The sweet codeine expose into Nigeria's deadly cough syrup trade. The ban on the importation and production of codeine-related drugs in the country and the subsequent constitution of two committees on drug abuse mark the federal government's declaration of war against the societal evil.
This is a situation of emergency and we must address it as such. I therefore charge both committees to tackle the task before them with all commitment that it deserves in recognizing their appointments as a clear call to serve the nation. It is our collective national prayer that the labors of our heroes past shall never be in vain.
The launch of the Patients' Bill of Rights is to ensure protection for patients' rights as they seek health care.
The Patients' Bill of Rights is a very timely complement to these policy and funding interventions. It will ensure that the increased funding that is coming into the healthcare system in Nigeria translates into a direct improvement in the quality of the final output at what one might call the last mile phase of healthcare delivery.
Response to public health emergencies in the country was put to test by the outbreak of different diseases.
So many outbreaks happened last year. You know, we had outbreaks of cholera, measles, monkeypox. Yeah, even meningitis spilled over from 2017 into, yeah. So the fact that you now have NCDC as an agency set up by government and backed by law, and hopefully with the right budget to prevent infectious diseases, to nip them at the bud when they happen, is a big thing. Because you see, we seem to have forgotten that the last Ebola outbreak in West Africa killed about 11,000 people in Liberia, Guinea, and Sierra Leone, and about 8 in Nigeria. And because Lagos State and the federal government really nipped it at the bud, we're lucky. You know, but the first for having the NCDC bill signed into an act, that is a huge plus, because we know that the agency is now much more empowered to really prevent us from having infectious diseases that will kill people and destroy the economy. For me, I think generally as a people, we're very apathetic to health. We do not think that health is very important. However, I think that without health, really, we don't have anything. Because you see people pushing government for roads, good roads, pushing government for the economy, pushing government to build bridges and all, but very few people are interested in pushing government for healthcare. And that's why for us in Nigeria Health Watch, for this 2019, we started a campaign, Vote for Health Niger. What we're saying is that when politicians come to you, in addition to asking other questions, please ask them what their plans are for your health. How do they plan to ensure that 60,000 women in this country do not die every day from pregnancy, childbirth, you know, and afterwards?
It is research that develops progress, that moves the society. In the health sector, make research and development a priority. The way to go in Nigeria is development of our herbal medicine industry, because that is where we have comparative advantage. Our biodiversity is left fallow. There are a lot of plants that we can develop, and we do not need the millions of dollars that is needed to develop what we call chemical entity drugs. Herbal medicine has developed to the extent that nobody is talking about dosage again. Everything that you can do with chemical entity, what we call the active pharmaceutical ingredient, you can also do today with the extracts, what we call the herbal extracts. You can also do with them. The HPLC, the NMR, the GCMS, all those sophisticated equipments that we use when we are looking at our active pharmaceutical ingredients, we now use them today in herbal medicines. That's why technology has now been applied to it. So you now have something that you know the dose. You also know that when you are taking this type of herbal medicine, the other drugs you should not take with, or the type of food you should not take with.
It was a year almost devoid of strike, except for that embarked upon by the Health Workers Union. The 2018 vaccination of 26 million people in the second phase of the biggest yellow fever vaccination was another high point in the year.
An incredible job of increasing the numbers of functional primary healthcare centers in Nigeria. We're not there yet. If you go all across the line, we still have a lot of uncompleted primary healthcare centers or abandoned primary healthcare centers. This is part of the work that we're doing to ensure that those uncompleted primary healthcare centers now get completed, and those ones that have been renovated now have the full complement of human resources, the utilities, the commodities, the drugs, to ensure that people can come to these health facilities and get quality health care.
A functional health center per ward, as has been pushed for, like the 10,000 that has been pushed for, before 2018. But you see, the idea is that This is not the responsibility of the federal government per se, because providing primary health care is actually the responsibility of the states and the local government. Now, the federal government has taken initiatives. They have promoted this. We are hoping to see a commensurate response from the state government, especially in 2019. We hope to see that the state government prioritize health spending to the point where at least each ward in their state gets a functional health center. It's not to have the building or have a place without drugs or have a place without personnel. It's to have a functional health system. That itself will reduce the burden on the tertiary system that we have, and then we are hoping that we could achieve a better healthcare services in the country in 2019. But I think most fundamentally in 2019, I'd like to see health promotion take a better place, take a higher priority. What do I mean by that? There were some outbreaks this year. Things like Lassa fever, yellow fever. There were outbreaks in 2018. What you call infectious diseases that showed up, here and there. They could have been avoided completely, right? If people did just the very basic things, Lassa fever, it's keep your environment clean so that those kind of rats that transmit those diseases are not in your environment, right? Just wash your hands, simple things that people could do. So you would expect to see a lot of this in 2019. I hope that people begin to seek health behavior in a better way, because Nigerians just seem kind of complacent with their health. We rely on God, which is good, right? But there are things that we could do to not get sick, because the most important thing is that the productivity of every household goes down when you get sick. The household head can no longer go to work, even if one member of his household is sick, and that is the reason why we should begin to change our attitude towards health promotion. At the government level, we hope to see a lot of emphasis on health promotion, because when people have better health-seeking behavior, then there will be less spending on emergency response, because people would have known what to do.
In terms of updating this place to a center of excellence in cancer treatment that meets the standard anywhere in the world, we have the most modern cancer treatment equipment, and also in a brand new building that also has a CT scan that can be used for us, and is being used for simulation for the patients that need to be treated on this machine. So this is one of the best in the world. It is of international standard, and I think what the government is trying to do is to have 7 such centers, meaning 1 in each geopolitical zone, with Abuja being the center, being the first to take off. I think Lagos will soon be fully on stream as well. So what is happening now is that we never have a situation in which we will not have an equipment functioning, because we have to. So when one is undergoing maintenance, the other one will be functioning. And there will be times when, most times, both of them will be working, and we can treat several patients on a daily basis. So this is the most modern you can have, in terms of the fact that it is a multi-leaf linear accelerator. The center has been accredited by the Nigerian Nuclear Regulatory Agency for treatment of cancer patients. Also, the International Atomic Energy Agency has visited and certified the center as well.
The first thing is to say upfront that health is more than infrastructure. Health is about infrastructure, is about human resources, is about commodities, is about data. And it's also about service and quality of service. And we are addressing this holistically in all spheres. The first thing is you've been to some of our facilities. Investment in tertiary hospital we're doing at 2 levels. One, a general level. You will notice improvement in many of our facilities, putting in new structures, and I've gone to commission some of them. I've gone to commission a cardiac center in Bandu Bello University Teaching Hospital. I went to commission an ICU in University of Benin Teaching Hospital, a stroke center in Lagos University Teaching Hospital. So these I've done across the country. But what is important is that the next phase will be a big bang. We're working on it. That will be in terms of a strategic investment and partnership with Sovereign Wealth Investment Authority.
No wild polio virus was discovered in 2018. However, The World Health Organization announced the discovery of a vaccine-derived poliovirus in Bauchi, just as the Nigerian Center for Disease Control reported some cases of acute flaccid paralysis. None of them, however, turned out positive, a pointer that the country is on the verge of being declared polio-free.
By August this year, hopefully we'll become polio-free, and who knows what will happen afterwards. But I'm also a bit worried, because even if we become polio-free, that means that most donors will now hands off. So if they hands off, all those things they are funding, for example, for the AFP surveillance, those people, those disease surveillance and education officers that go from villages to villages collecting stool samples when cases of polio are suspected, who will pay them? Who will take over their functions? Who will make sure that those functions continue with the kind of funds WHO, for example, uses to back them up? So, and that's why you see it's a mixed grill. We're doing well in some sense, but in another sense, if we continue in that light, it's not sustainable. And this is where why I think that with the health insurance being signed, now if people actually buy into it, what happens is that funds will be available.
Health is wealth is a popular saying. What can anyone do or achieve without good health? It's all about your well-being, and Health Options has these health tips to take you through 2019 and beyond.
Happy New Year to all of us, Nigerians. There's a saying that we become what we eat. So we need to pay attention to what we put inside our mouth, because whatever we eat can help our organs to work well, can also harass our organs to fail. We need to reduce the amount of sugary things we consume. We need to step down on the amount of oil that we also consume, and we need to step down the amount of salt that we take on a daily basis. In the area of exercise, it's very important for us to exercise, because for us to maintain metabolic balance and prevent disease, we need to burn whatever amount of calorie we take in each day. The exercise has, a number of advantages. Our circumstances in Nigeria are quite stressful. And so we need to, look at how we can reduce stress for ourselves in this country. We need to relax, because if we don't take care of stress, there are certain chemicals our body produce during stress. They are very harmful. They can cause diabetes, they can cause hypertension, ulcer, all kinds of things. So we need to, look at our stress level and see how we can step it down. Also, very importantly, sleep. Sleep is very important. In fact, somebody describes sleep as a washing machine for the brain, because during sleep, the brain is able to get rid of all the, toxic proteins that we have secreted, throughout the day as we go through one stress or the other. So when we sleep, we give the brain some rest, and we're able to get rid of, the toxic substances. Also, there's what we call brain hygiene. That's being able to preserve the brain to see us to old age. Drug abuse is a very serious problem in Nigeria, particularly even among young people. It's very sad, because drug abuse has these consequences. It affects the brain a lot, and you find out at the end of the day, particularly the substances that cause dependence. At the end of the day, it can even make this person become, frankly, psychiatric. Kidney disease is a big problem in Nigeria right now, both among the young and the old. And some of them, actually, it is because of, abuse of analgesics. So if we have pain, sometimes we have headache, All it requires may just be to take a rest and the headache will disappear. We don't necessarily, have to take analgesics for that. So, but if we have pain that is severe enough for analgesia, I think we should see a doctor and let it be prescribed, and you'll be given the number of times, the number of days, so that once the number of days are completed, you stop. So people should not be on analgesia or analgesics, continuously without stopping. It has its consequences on the organs that we handle it, and that's the liver and the kidneys. It's very important for us to drink water because 60% of our body weight actually is water. So we need to drink water as much as, we can get safe water to drink. Water helps us to get rid of all the toxins in our bodies. For example, when we go to pass urine, there are a lot of things in that urine, but the kidney, that's the main function of the kidney, is to help us get rid of all the toxic substances from our bodies through the urine. So when we drink water, we are helping the kidneys to do its work properly. I mean, all of us know that when you fast or you don't drink water the whole day, when you go to pass urine, that urine is very deeply colored. What that color is telling you is that you are dehydrated. The kidney is struggling. So it's so important that we drink water as much as we can so that we help the kidney to do its work well. Also, when we drink water, it helps our bowel to move. And it's important also that we move our bowel every day. When we are constipated, it's not healthy because what we are doing is leaving the stuff there and allowing the intestines to absorb as much toxin as possible back into the body. And some of those toxins actually can cause cancer. Even the skin, if we drink enough water, the skin will look supple and will look nice and smooth. When we are dehydrated, the skin is rough. People should not be afraid, okay, they say if I drink too much water, I'm going to add weight or something. There's nothing like that. If we are able to make some positive change in each of these areas, I'm sure it's going to help us.
You heard it all, and it is our hope that you put them into practice. And it is on that note that we wrap up this first edition of the program in 2019. Remember that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I am Rabi Abdullah. Many thanks for watching.